So there was also several academic data and real-world data in patients with Duchenne muscular dystrophy. One of the example is the North Star Registry, and there are data that will probably be extremely interesting to use when we will benchmark the patients who have received gene therapy. And one of the interesting data was a new way to look at the North Star and to have a kind of centile representation of the North Star, which means that what is the 10, 20, 30, 50 centiles for the different age for patients with Duchenne muscular dystrophy, so that you can figure out at any age if your patient is in the lower range, in the middle range, or in the high functioning range of patients. And I think that today it's purely descriptive, but as you might imagine, this will be extremely helpful when it will come to better understanding the effect of treatment. And then there was also a very interesting study from the Netherlands about the quality of life of these patients when they are adults. And it's clear that these patients, most of them underline the quality of life that they have in terms of possibility of activity, but that at one point they need to engage into their own relationship and independently of parents. And it was an interesting point out of this survey to show that for these patients, yes, they may have several opportunities that make them happy in terms of activity, but what is missing certainly is the autonomy and independence. And to finish on this topic, another interesting poster was about the quality of life of patients, and something that is striking is that the quality of life reported by patients in comparison with the level of disability is kind of an inverse U-curve, which means that patients with a very severe disability report an excellent quality of life, and that the lowest quality of life is in patients who have difficulties in ambulation. We need to walk with a stick. And in a broad range of patients with neuromuscular conditions, patients with Duchenne, non-ambulant patients with Duchenne reported quite an excellent quality of life.
I think one thing we're realizing as a community is that with the pace of science so rapidly advancing in terms of genetically targeted treatments and other muscle supportive treatments, there are many diseases that we don't have a very well-established natural history for, that we can't possibly begin to study interventions in rationally without having an established natural history as a comparator. So there's a lot of hard work being done on more rare or ultra-rare neuromuscular disorders, trying to have a standardized way to measure them in the clinic, look at whatever biomarkers we can in the way that the disease affects various systems in the body, and have that be done in a rigorous and a standardized way across centers. So many registries are starting to develop that work. Of course, also when we bring new treatments into the clinic, phase 4 or real-world evidence studies are critically important, and there was several updates about various registries in spinal muscular atrophy and also in Duchenne related to some of the approved treatments that we have in the United States and other areas of the world also, such as exon skipping or stop codon read-through, which is not available in the United States but is available in Europe and some other countries around the world for Duchenne. So those updates are really important for understanding what the impact of these new treatments are in a real-world setting and how it's actually changing the lives of people living with the disease that are receiving it.